Breast carcinoma. Let's go. Is triple negative breast carcinoma aggressive? Yes, it happens to be the most aggressive. What are the two main risk factors for breast carcinoma in men? It's a BRCA2 mutation and Klinefelters. What happens when there are increased menstrual cycles in a female? They have increased risk of both breast carcinoma and ovarian carcinoma. Now I'll be dealing with non-invasive breast carcinoma. In which non-invasive type do we see eczematous patches over the skin? Paget's disease. Usually the nipple and the areola is involved. What are Paget cells? They are intraepithelial adenocarcinoma cells. How does ductal carcinoma in situ look under the microscope? Usually we see neoplastic cells filling the duct, and we also see engorged blood vessels. And how is it seen on imaging? There are microcalcifications. In lobular carcinoma in situ, there are no microcalcifications. Which non-invasive breast carcinoma produces a mass? None of them. Not ductal carcinoma in situ, not lobular carcinoma in situ, and not Paget's disease. How is lobular carcinoma in situ usually diagnosed in a clinical setting? It's an incidental finding on biopsy. If lobular carcinoma in situ is diagnosed, then there is an increased risk of cancer bilaterally or unilaterally. Usually, if a lobular carcinoma in situ is diagnosed, that means either breast is at a high risk of cancer, and if ductal carcinoma in situ is diagnosed, then the same breast and especially the same quadrant is at a higher risk of cancer. Which ductal carcinoma in situ subtype usually has central necrosis? Comedocarcinoma. Here there's central necrosis and dystrophic calcifications. Now I'll be dealing with invasive breast carcinoma. Decreased expression of what leads to invasive lobular carcinoma? Decreased E-cadherin expression. How does it look histologically? Invasive lobular carcinoma usually has a single file of cells. There are no duct formations as they are seen in invasive ductal carcinoma, and it's usually multiple bilateral lesions. Which breast carcinoma lacks desmoplastic response? The invasive lobular type lacks desmoplastic response, and its desmoplastic response is usually seen in invasive ductal type. Which subtype of invasive ductal carcinoma is seen in old women? Mucinous type, and it has increased extracellular mucin. The other subtype of invasive ductal carcinoma is tubular type, and here we see well differentiated tubules which lack myoepithelium. Which invasive breast carcinoma has peau d'orange, or as we call it here, peau d'orange? Inflammatory type. So they present with a warm, tender, swollen, erythematous skin above the breast, and this is due to the involvement of dermal lymph. What is it commonly mistaken for? Paget's disease and mastitis. The 5-year survival rate for this happens to be 50%, which means the prognosis is pretty poor. Which tumor mimics fibroadenoma. The medullary type. I guess you can use the fact that they present at different ages to differentiate them. Fibroadenoma usually presents in women under 35 years of age, and medullary type breast carcinoma usually presents post menopause. Which type of WBCs are seen in medullary type carcinoma? Lymphocytes and plasma cells. They are seen along with large anaplastic cells in sheets. Thank you.